Good. So, doctor, thank you for having me in the practice.
Yeah.
I must say that I'm absolutely impressed. I got to listen into some of your treatment coordination, talking with your different patients, special needs, your care factor and such. So I got a question for you.
Mm-hmm.
I mean, I can tell the amount of attention, care, energy that you put into each and every patient. So I want to hear about how challenging is it and how rewarding it is.
Yeah. So the challenge is just the time that it takes, because I do want every person to feel like that they were given the adequate amount of time, and not just that, but also really getting them to experience just how much I really do care for them. And so the challenging part is I have other patients, and I want to give them all the same amount of time as well. So just keeping on that type of pace is what makes it challenging. But the rewarding part of it as well is that my patients to me are more than just clients or patients. You know, we do really become family when they step into my practice. And so it's like a family reunion every time I get to see them enter my door, and I love getting to hear about their lives and just how things are going. And then even at times where if things aren't going well, then getting just to sit with them and cry with them or pray with them and so getting to celebrate the wins, but also getting to mourn with them in the losses. And so it's like I said, it's rewarding because I'm not just working on strangers, but I'm getting to work on people that I love and care for.
I love that. And I saw it and I heard it.
Cool.
Very impressed. And not just you, your whole team.
Yeah.
Yeah. I mean, it really, what you and Gloria have created here, I mean, it really resonates down. So well done on that.
Awesome.
I want to talk about how important this is. Can we go over there and this view?
Let's do it.
So you've got this, you're sitting here and you're treating patients and you got this.
Oh, I know. It's serene.
It is. Would you say it actually is a contributing factor to the vibe that is created of comfort? Tell me about that.
Yeah, 100%. So part of what our practice specializes in is patients who have high anxiety and also special needs. And there's just something about just natural lighting in the outdoors that is just therapeutic for anyone. And so part of what is unique about our practice is this just beautiful view that we get to enjoy every day. And I mean, every day I walk in here, even for myself, it does not get old getting to see this view.
Right.
And even the wildlife that even roams through here, even though it's a golf course, we get to see a lot of that, and patients get so excited to get to see a deer, or a turtle, or a goose. And it's funny, like I always love to hear the reactions that when they step through the threshold of our reception area into into the clinic, every time they're like, whoa, what a view. Like, we hear that all the time. And so it has really become kind of like a staple of our practice.
Awesome. Last thing I want to ask about. So I saw special needs. I saw young patients. I saw people, towards the end of their life, and you were caring for everybody, all shapes and sizes, all ages, and then full mouth. I saw full mouth rehabilitation, like large cases. So, maybe you could just touch on what can you do? It sounds, from what I saw, just about anything, but tell me a little bit about your skill set and where that goes and where that ends and what you don't do.
Yeah, absolutely. So it's very important for me to be able to offer my patients a comprehensive plan that gets them to full vitality and health. And so for me, when I was in my education within my schooling and residency, I wanted to make sure I gained the broadest skill set. And even now, after post school, I still continue. I look to see, okay, what are the needs of my patients, and the skill sets I add to my repertoire or to our practice are ones that are going to continue to better serve our patient population and really make our practice a home for patients. Like I mentioned, people who have high anxiety, it's hard just to step into the dental office like on its own.
At all.
And so when they learn to trust someone, if I have to send them somewhere else and they have now got to have to trust that person,
over again, right?
I'm just creating more barriers for them to getting healthy.
Sure.
And so it's very important for me that not only am I providing a broad range of services, but I'm providing it at the level of a specialist. And so, like I said, because for me, it's a matter of like caring to the person to the utmost highest of standards. And so we are capable of, I mean, almost anything within our practice. I mean, our youngest patient was 2 weeks old. Our oldest was 103.
Wow.
And so, so it is important that we're able to care for all shapes and sizes and ages of people. And now there does come a time where we can't, you know,
Sure.
there's things that I am not a specialist, and I'm one person. And so when I see a patient and I feel like there's a situation that maybe, yeah, I could handle it, but it would be better in the hands of a specialist, in the best interest of the patient, I will recommend them and refer them to that specialist.
Great. Great. Can we walk through and just see some of the different operatories?
Sure.
So
Yeah.
lead me through.
All right, come on, follow me. Follow the yellow brick road. No, I was kidding. So yeah, so we have 6 operatories all together.
Okay.
So 2 of our operatories are assigned to hygiene to service those patients, and then we have 4 that are meant for doing like treatment. But really, they're kind of interchangeable, and we plug in wherever we need it. And we even have portable equipment that if we need to go to an operatory that's not normally designed for hygiene, we can make it fit and customize it to fit hygiene. That way, we can still don't have to delay a person's care.
Great.
And so yeah, so we have 6 altogether. So it and every single operatory -1 has the beautiful view of the golf course, and that way patients can always get to enjoy that. So the one operatory that doesn't have that view is usually the one that we use for when people are sedated, because when they're sedated, it doesn't matter to them whether they can see that view or not.
That's great. Okay, good. So, okay, now tell me about the importance of your team. I see the amount of time you put into training the team. I saw your morning huddle this morning. I see what you do throughout the day. Tell me about that. I mean, I've got to meet all your great team members, and really, we're impressed. So, how'd you do that?
Yeah, so that's a wonderful question. So I like how you started by, you asked to tell me about your team. So that word team is very important to me. So a lot of times within the industry, it's very common to say staff. So I've always liked to joke around and say, well, to me, the word staff makes me think of an infection, whereas I like I like the term team because to me it builds unity.
Sure.
And so, and it adds to the culture. Staff to me is like there's like a superiority, and whereas I feel a team is more unifying. And so same thing, like when I invite someone to come work at our office, I ask them if they will come work with me versus come work for me. So all of those things just come down to like the foundation of the culture that we want to establish here. Culture is everything to me. And so because I'm one person and I cannot do this alone. And so we have such a great mission and great vision as to how we want to care for people, because that's what we're here for. And so it's more than just dentistry for us. And so it's so important that I have a team that also shares in that same culture, that same vision and mission. And that's what we've worked towards, really just building towards. And so for me, it's exciting that I get to come alongside these amazing individuals and get to care for our patients, because there's just something about when you get to share in the reward, right? It's like, it's one thing to receive a gift for yourself, but then when you get a gift that you can share with others, it's just so much more enjoyable. And that's kind of how I feel about my practice.
I love it. I love it.
Cool.
Good. So last thing I'm going to ask. Okay. So this is now the MGE spotlight, meaning, so I'm going to highlight you as a client. I'm going to talk about you as a client. I've now been to your office. I've met your team. I've got to work with you and Gloria really, remotely, but now I get to see it and your whole team. Tell me a little bit about your experience with MGE and how has that impacted or strengthened what you'd already created? Because you and Gloria had this thing really running quite well, even by the time you came to MGE.
Yes. So what MGE has helped me or has strengthened me in is really big part of it is my communication. My communication with my patients, with my team, and even with my spouse, Gloria. And I feel like, they always say like, communication breaks, it will make or break ARC. And really, in order to be successful and survive in life, you have to be able to communicate. And so And so I see just how that refinement in my communication and what I say in my communication, but also allowing others to say what they have to say, and then truly hearing and seeing them and what they're saying, it has built deeper connections. It also has revealed intentions. And so, with what it reveals, it helps me know as far as like, how do I move forward with people in general, and how we're going to come alongside together, or how do I come alongside them in better service and care for them. And we were blessed that when we came to MGE, I was drowning under the weight of the patients that we had. And so one of the main things that we came for too was, look, how do we manage this overflow? I'm drinking from a fire hydrant. I can't keep this up. And so I love to give the illustration of like I Love Lucy. There's this episode where they're at a chocolate factory.
Chocolates. I know exactly the one. Too many chocolates and she's stuffing them in. Yeah.
And that's how I feel, right? That's where we're at. We have too many patients.
Mosquito in a nudist colony.
That's the next one. I love it. So so you're right. And so it's so funny because another thing I've learned is not being reasonable with barriers, right? So many people I would tell them about this, and they're like, well, you need to halt you accepting a patient, but it's like, you don't realize it takes people 5 dental offices to find me most of the time.
It's all gone wrong, each of those 5.
Yes. So it's like, so if I limit, then where do they go? If not me, then who? And so so also part of what I gained from MG is learning how to have a more efficient schedule, and by having a more efficient schedule, it's also helped our just being able to accommodate and care for more people. And like I said, but ultimately, like I said, it all stems from communication. The better we communicate as a team, so me and my team, and then my team also communicating with one another, it ups the morale, it ups our efficiency, and it ups our patients' acceptance, because it makes it a place where we're all able to come to a reality with one another and ultimate understanding.
Love it. Well, hats off to you both, because in less than a year, you've taken your practice to about 3 times the size. Would that be accurate? 2.5 times, 2 times? What would it be?
Yeah.
So well done to you guys.
Cool.
Well done. Good work.
Well, thank you. Appreciate it.